Welcome to Medicine Made General, a podcast for patients brought to you by the Johns Hopkins Division of General Internal Medicine. I'm Katie Cavanis-Crowley, and I'm here with my co-host, Dr. Bimal Asher. Today on the pod, we have Dr. Maya Venkataramani. She's a general internist and pediatrician. Welcome, Maya.
Thank you, Katie. It's a pleasure to be on with you both.
Thank you, Maya, for joining us. Before we get into vaccines for adults, which we're general internists, we take care of a lot of adults. But this is a timely episode, and there was an executive order recently that conveyed some concerns about vaccines specifically for children. And a number of our listeners have children or grandchildren who are, seeing their pediatricians and getting vaccines. And, you're board certified in both adult medicine and pediatrics. And I wonder whether you would comment on the executive order and concerns regarding safety of vaccines in children. Specifically, they brought up a lot of stuff about autism, and maybe you could just share briefly your thoughts with that.
Yeah, thank you, Bimal. I appreciate being able to address that as a pediatrician. So I would say, as the American Academy of Pediatrics and many other organizations and healthcare leaders have noted, it's really important to emphasize that there hasn't been any new evidence to really justify the executive order's changes to our childhood immunization schedule and also the changes in the order around the guidance around vaccination. To date, there's been dozens of studies that encompass millions of data points and people that have not demonstrated evidence of a link between vaccines and autism. What we can say is that childhood immunizations and vaccines in general are considered one of our greatest public health achievements and one of our strongest tools to prevent disease and death. And the childhood vaccination schedule that we have in the United States has been developed over decades to specifically address the health of children who are growing up in the U.S. So this includes recommendations that children receive vaccine at certain ages in order to ensure the best immune system response and to protect children when they're most vulnerable to those infectious diseases that the vaccines protect them against. And when we limit vaccines received at visits, we put the extra burden of coming back to the clinic to get those vaccines on families. So overall, it runs a risk of children either having delayed or completely missing important vaccinations. And this is a real concern to all of us as we're going into the respiratory virus season, the back to school season, and also our grappling with measles cases being at their highest in decades.
Thank you for that, Maya. I appreciate taking the time to go through that with us. For the rest of this podcast, we're going to do something a little bit different than previous episodes. Bimal and I are going to pretend to be your patients, and we have questions about vaccines. So by the end of this episode, we want our listeners to walk away with 3 things they should remember about vaccines. So I'm going to play the role of a fairly healthy woman in her mid-30s. And Bimal, can you tell us more about who you'll be playing?
Yeah, so Katie, I'm going to be playing a 65-year-old gentleman, and no, I am not 65 yet, but I'm going to be playing that role. I am trying to stick to a healthy diet and exercise program. I live with my wife who does have some immune deficiency. I'm wondering, Maya, what vaccines would you recommend for me?
Okay, thank you, Bimal. So first of all, as your podcast primary care physician today, I want to commend you on your efforts to maintain your health, whether it's through staying active or eating healthy foods. And I think one reason that you're doing all of that is to really remain healthy and prevent conditions such as diabetes or heart disease over time. In the same vein, vaccines are a really important tool to prevent the development or reduce complications from serious and deadly infections. So yes, just as I may advise you to exercise more or increase those fruits and vegetables in your diet, I'm going to advise you to stay up to date on recommended vaccines. Not to mention, when you are vaccinated against certain infections, you're also helping to reduce the spread of those infections to others, including those who are particularly vulnerable, such as your wife. So those benefits really extend beyond yourself.
Okay, so in this scenario, I'm a 35-year-old woman, and I would also like to add the caveat, I'm not 35 yet. But I just recently had friends who had a baby. But because I'm fairly healthy, I don't really feel like I need to be vaccinated because of this. But do I really need any vaccines?
Yes, Katie. So for the very same reasons that I mentioned to BMO, vaccines are also important for you. Independent also if you're around a child, and we can get into what those vaccines may look like. But I would tell you also to be active and eat your fruits and vegetables, but also to get vaccinations as well.
Okay, so we both need vaccines, but I guess my question is, are vaccines safe? Can you talk more about that?
Sure. Yeah. So vaccines are safe. Before a vaccine is approved to be used in clinical care by us, it has to be tested for safety. And vaccines, just like medications, go through various stages of clinical trials in which we examine not only is the vaccine effective, meaning how well it works, is it doing the job that it's supposed to do, but also in which we examine side effects and safety. And the standards that are used for assessing vaccine safety are actually considered higher or more rigorous than those for medications, for example. And it's also important to note that even after a vaccine is approved for use, organizations like the CDC and FDA continue to monitor vaccine safety over time. So there are systems to collect information regarding other adverse events, such as side effects that occur, and these are continuously being monitored and assessed.
So, Dr. Maya, I'm always a little suspect of anything new. And, one of the things that people have talked about is this mRNA vaccines. And, it kind of scares me on what's being created and, how are they different and are they safe?
It's a great question. So mRNA vaccines are safe, and you are right, a lot has been made of mRNA vaccines. I received this question a lot during when the COVID-19 vaccines first rolled out, because both the Pfizer and Moderna vaccines, as we commonly refer to them at the time, were mRNA based. So to get to the point about how they work and whether they're safe, so vaccines in general work by teaching your immune system in your body to recognize and respond to a bacteria or a virus. And there's many different types of vaccines. They vary in how they teach your immune system and how they get your immune system to recognize that bacteria or virus. So some vaccines may present like an inactivated version of a virus to your immune system. Others may show or present like a small piece or subunit of the bacteria or virus for your immune system to recognize. mRNA is a molecule that is produced in all our cells that your cells read like a code to make proteins. And in the case of mRNA vaccines, the vaccine itself contains a small mRNA code that your cells read to make that protein that is relevant to the virus that they then recognize. And that makes your immune system, again, teaches your immune system to recognize that specific protein. The vaccines are considered safe, just as the other types of vaccines I've discussed. And they, just to note, go through the same rigorous process to ultimately prove that they're safe, just like we discussed a little while ago. So in fact, the FDA just approved the use of an mRNA-based flu vaccine just a few days prior. So yes, mRNA vaccines are safe, and they're just a different way of teaching your body how to respond to and recognize a bacteria or a virus.
Dr. Maya, I have a question. So when you say that there's rigorous testing involved, can you say more about that? Any like specifics of what that looks like?
So what, in terms of vaccines themselves, just as with medications, there are stages of clinical trials or phases that vaccines have to go through to basically, ultimately be approved for use. And so they are phased. There's first a small phase where we gather more information on how safe a vaccine is in a small group of people. So it could be up to 100 people. And then a larger trial where we start looking at both side effects and risks, but also how well that vaccine is working. And through each phase, that data is monitored before we go into the next phase to test the vaccine moving forward. Then there's a larger trial that enrolls thousands of people, right, in which they really, again, look at how well the vaccine works and also monitor for those side effects that they might have noted in the prior two phases of the trials. And then after FDA approval, there will be ongoing studies to continue to look at the vaccine safety. So you can see it's a multi-step process, and it's really done very carefully to make sure we understand what the potential side effects are and also make sure it works, right? We're introducing a vaccine that's doing its job.
Okay, gotcha. Thank you. That's super helpful and very convincing. I am convinced to get this, especially, with friends who just had a baby. I want to meet this baby. So as a 35-year-old woman who is healthy, what shots do I need to get?
Sure. So when we review vaccines, or when I review vaccines for my patients, I think of some specific categories that go through my head as I'm looking at the list that a patient may need. One is the vaccines that are routinely recommended for someone in your age group. And of note, vaccine recommendations look different based on age, and this reflects both when individuals are most at risk for certain diseases, and risks can change with age. And also, sometimes the protection provided by vaccines can fade over time. So the vaccines I might recommend to you based on age will be different than those I may recommend to BMO. I also think about vaccines that are recommended based on whether you have other health conditions or other risk factors. A third group is vaccines that we usually recommend on a regular basis due to high risk of exposure to infections such as a flu shot. And then boosters or vaccines that we recommend based on when you might have received this same vaccine before, because protection provided by some vaccines can fade over time. There are also another whole slot of catch-up vaccinations based on whether you didn't receive certain vaccinations as a child, and vaccines that may be recommended if you're traveling to certain parts of the world, and I know that about you, and that's also something to consider. So let's go through the vaccines for you, 35-year-old Katie. At the age of 35, there may not be certain vaccines you're like newly recommended to receive just because you're 35, but I'm going to make sure that as we talked about in terms of those other vaccinations, I want to make sure you've received your childhood immunizations in childhood. And if you didn't, I would discuss catching up on certain vaccines. One of those I'd just highlight, given your age, is the hepatitis B vaccine. So a few years ago, the CDC and the Advisory Committee on Immunization Practices, called ACIP, put out new recommendations recommending universal hepatitis B vaccination for adults ages 19 to 59 years, if they hadn't been vaccinated prior to this. And of note, and relevant to BMO later, adults 60 or older may also be recommended to receive the vaccine as well. If you were born in 1991, there is a chance, because that is the year when the hepatitis B vaccine was really first recommended for all infants universally. So there's a chance you may not have received it or the full immunization, but you probably did. But I would like to make sure that that's documented. And if not, I would talk to you about getting vaccinated for that. As well, for a healthy 35-year-old, I'll just make sure you had received your childhood vaccinations against measles, mumps, rubella, chickenpox, and polio virus as well. Particularly important if you're around people who are at risk, including infants. And finally, if you haven't had the human papillomavirus vaccine, that's something that I would have a conversation with you about. That discussion is more around your desire at the age you are to be protected from any ongoing risk of HPV infection. You noted you didn't have any other health conditions or risk factors, but if you did, I would kind of go through some of those vaccines that could be recommended for you based on age. One common one is if you had a history of tobacco use or chronic lung disease like asthma, I might talk to you about getting a pneumococcal vaccine if you have not. And then there's certain vaccines, if you come to me during right prior to the flu season, I would recommend receiving the influenza vaccine. We normally recommend receiving it in September, October as we get into the influenza season. And we may also discuss with you receiving the most up-to-date version of the COVID-19 vaccination. And then based on boosters, and this is particularly important with your question about being around an infant, we also make sure that adults are up to date on their tetanus vaccine. So that means making sure that you've received a vaccine within the last 10 years. And that's assuming you received all your tetanus vaccinations as a child, which I will assume. So if it's been more than 10 years since you received a vaccine for tetanus, then I'd recommend you receive a booster. The booster you receive could either be a tetanus diphtheria booster, or called TD, or tetanus, diphtheria, and acellular pertussis booster called Tdap. Acellular pertussis is also known as whooping cough. And we recommend for adults, if they've never received a Tdap vaccine at age 10 or older, that they get that. And particularly important for adults who will be around young children.
All right. Now do me. 65-year-old man, remember, my wife has immune compromise.
Sure thing. So let's walk through the process again, BMO. I'm focusing you on the young age of 65. So as I mentioned before, when you turn, in terms of the age category, when you turn 65, there might not be new vaccines that you're specifically recommended to receive just because you turned 65. But based on age alone, I want to make sure that you've received some vaccines routinely recommended for folks in your general age group. So one of those for folks who are ages 50 and older is the shingles vaccine. And then the second one would be also making sure you've gotten your pneumococcal vaccine. You've noted that you don't have any other health conditions or risk factors, but commonly at the age of 65, people have maybe developed certain common risk factors like COPD or asthma, or in some cases diabetes. And there are some vaccines I would check to make sure you have received given that general age group. Again, just given this common like things like chronic lung disease, COPD, emphysema, asthma, if you had heart failure or diabetes with certain complications or diabetes for which you require insulin or specific medications, I would talk to you about making sure that you received between the ages of 50 and 74 years the RSV vaccine and discuss with you about whether you'd be interested in that. Once you turn 75, then we would be discussing the RSV vaccine as a general recommendation, but you got a little while to go there, so that's good. In general, that vaccine we'd recommend you get ideally between August through October, because that'll get you primed up for your immune system primed to really protect you before the RSV season, before RSV begins to spread. And then there's those vaccines again that we would recommend based on the kind of seasonality of things, the influenza vaccine. At the age of 65, I would note for you that I would recommend you receive what's known as a high dose influenza vaccine. The reason for that is that as you get older, and again, this isn't 65 is not old, but as you get older, your immune system might need a little bit more teaching to kind of really learn and respond, right, to the vaccine. And these vaccines have been shown to have the best immune response in older individuals. If you don't have access to a high dose vaccine, then I would encourage you not to delay the vaccination, right? It's important you get vaccinated, and so that's important. But my recommendation would be, let's get you the high dose influenza vaccine. And then the COVID-19 vaccine at age 65 and older, assuming you've received, the prior season's doses, you are recommended to receive at least 2 doses about 6 months apart for that as well, for the most updated version of that vaccine. I'd also, just as I talked to Katie about, look at your boosters. So again, make sure you're up to date on tetanus, particularly again with being around both an immunocompromised individual and your wife, but also potential grandkids. Make sure if you have not received a Tdap vaccination as an adult, and that would be the recommendation for that particular booster as well. And in general, I think receiving these vaccinations again gives you the ability to protect those around you, including your wife, who may be most susceptible to these diseases.
That's quite a few vaccines, and you are very convincing, and I am convinced to get all of them. Hypothetically, in this hypothetical situation that we're in, what happens if I decide not to get these?
Sure. So as I mentioned before, Katie, vaccines are an important tool to really prevent the development of serious and deadly infections. So I would be concerned if you did not receive them, that you'd be at higher risk of getting these vaccine preventable infections if you decide against them. But I also continue to emphasize, just as I would if you receive the vaccine, for you to take precautions to reduce your risk of exposure to these infections as well, right? So I would continue to have that conversation with you about the things we do, for example, for respiratory viruses in terms of like hand hygiene and being careful who you're around, and if you're symptomatic, not exposing others, etc. But I would encourage you to rethink that. And also I would always tell you to come back to me with those questions and concerns. And if you change your mind in the near future, do not hesitate to let me know, because our goal is to be able to, have shared decision-making around this.
So, Dr. Mai, one of the vaccines you recommended for me was that shingles shot. And I got to tell you, I got a close friend who just said it was nasty, and they were down for a while. And, what if I just wanted to skip that one?
I've heard those stories too, about the shingles vaccine. My patients and family members have described some of those symptoms, like body aches, fatigue, headaches, sometimes having nausea and vomiting. So I would say this: we generally note that folks who get that shingles vaccine can have some of these symptoms, but it's self-limiting, resolve usually within 2 or 3 days. And I can understand why, again, someone may say, hey, I don't want to go through that and to skip this or other vaccinations, but I would really advise against skipping this vaccine. So about 1 in every 3 folks in the US will have shingles in their lifetime, and it is a very painful condition to endure. But in addition, it can result in complications such as long-term nerve pain that can occur for months or years after the rash goes away. And we have evidence that the virus that causes shingles, herpes zoster virus, can increase the risk of heart attack, stroke, and dementia. And we know that this vaccine also, there's been recent studies just within the past 2 years or so that have demonstrated that the vaccine may actually help lower the risk of those other complications of herpes zoster. So I would say this is not a vaccine I would recommend that you skip. Again, it's not 100% that you would have those reactions, but if you do, it will be self-limiting, and just take it easy during those 2 to 3 days after you get it. But then after that, you will be in a good spot. And a reminder, it's 2 doses, so at least 4 weeks apart.
So respiratory virus season is about to start. I was wondering if you could give me a little bit more on what that means, and what should I do to protect myself, my friends, their new baby, others around me?
Absolutely. So the main thing, as the theme of today, is it's important to stay up to date with immunizations, not only those that are specific to the respiratory virus seasons, but all immunizations in general. And again, specific to this respiratory virus season, we talked about the annual influenza vaccine or the flu shot. And the optimal timing, again, would be around September, October. But if you have to get it earlier, or definitely if you need to get it a little bit later after that, we still recommend that you receive it. In this respiratory virus season is also the RSV season, and that's particularly notable not only for how it impacts young children and infants and young children, but also older adults. So that's why we talked about those 75 and older should make sure they've received this vaccine. And again, adults 50 to 74 with certain risk factors as well. And in addition to this, in addition to vaccine, just to remember to follow important measures to prevent the spread of these viruses and bacteria and germs, good hand hygiene practices, cleaning surfaces, and taking precautions and measures to stay away from others if you have symptoms or if they do, right? We have all the tools that we've used before, which include things like wearing masks if you're symptomatic, and avoiding exposing individuals who are at highest risk, such as your friends' baby or BMO's wife, for example.
So, Dr. Maya, a couple of years ago, I took the flu shot, and I swear I probably got the flu right after it. And I wonder whether, that was the case.
It's a great question. So the flu shots themselves cannot give you the flu. So we had talked about how vaccines work before, and the flu shots themselves may either have an inactivated version of the flu, which is not infectious, or they could even have just small proteins of the flu virus. But again, they're not introducing the flu virus into your body. So they cannot give you the flu. Sometimes people who receive flu vaccines may get side effects such as body aches, headaches, and fevers that are usually mild and short-lived right after they receive the vaccine. Oftentimes, this is an indication of your immune system learning, and revving up as a result of the vaccination. And so it sure may feel like you had something. It might have felt even like the flu, but it was not, the flu shot cannot give you the flu.
I need to factor in things like cost and insurance. Should I go to a pharmacy to get these vaccines? Do I need to find a doctor's office? Where do I go to get these? And do I need an appointment?
So this is a great question, Katie, and it really will depend on a few things, such as the vaccine you're trying to receive, right? Your insurance coverage and the specific pharmacy you're using, also your doctor's office and what they have in stock. Doctor's offices in general have many different types of vaccines in stock, but it depends on your doctor's office. Sometimes you'll be able to get and if they have them, you'll be able to get the vaccine either through an appointment directly with the doctor, but many offices offer appointments with their nurse or medical assistants, so you don't need to make a formal appointment with the physician. You should call your doctor's office to clarify that. Some individuals may have to get certain vaccines like the tetanus booster or RSV or shingles at a pharmacy because perhaps their insurance doesn't cover the vaccine being provided at the doctor's office. But your doctor can write that specific prescription and send it to that pharmacy for them to get it. And it may be that if your doctor's office also doesn't have a specific vaccine in stock, they can direct you to a pharmacy that does, and again, send that vaccine over. You will see pharmacies pharmacies that advertise and are able to provide you seasonal vaccinations like influenza or COVID-19 vaccination without a prescription. And that may be an easy way to access that for a lot of people during the seasonal during the respiratory virus season. And I would also note, don't forget to look into your local city or state health department as well if you're having trouble accessing vaccines. They often have specific vaccine clinics through which you can obtain vaccines, often at no cost or reduced cost.
I want to thank you for all of this. You've given us a lot to think about. It's a lot of vaccines, right? And but I wonder if you could give our listeners three things that they should remember about vaccines. Three suggestions that you have for them.
Sure. So I think one thing I would just like to highlight is that vaccines are really considered one of our greatest public health achievements. And they're one of the strongest tools we have to prevent disease and death at the individual and population level. They're important to your health. The second thing is vaccine safety and effectiveness are really examined and established through a very rigorous scientific process. And if you have concerns about any of that or questions, you should most definitely discuss that with your physician. And then another thing to note, you may need certain vaccines, again, based on your age, your health conditions, or other risk factors, and depending on when and if you've received certain vaccinations in the past. And then there are, again, those vaccines like the flu vaccines that are recommended when you're at high risk of exposure, such as during the yearly flu season. And so it's important that you kind of regularly review with your physician regarding the vaccines that you are recommended to receive, because some of these factors will change over time. And more generally, as this is Medicine Made General after all, I will always encourage you, if you have questions, concerns, or doubts, to reach out to your healthcare providers. We are here to help you talk through not only evidence-based recommendations, but to really talk to you through any of your questions or concerns, whether it be about vaccines or other topics related to your health and well-being.
This has been Medicine Made General from GIM at Johns Hopkins. Thank you for tuning into our podcast. We hope you find this conversation helpful. Until next time, stay informed, stay healthy.